Welcome back to our YouTube channel. Today we are going to talk about the tear trough area, and specifically two ways we can treat the tear trough area. One is using a hyaluronic acid filler and one is using polynucleotides. Let's start with what is the difference between the two.
So I think it's really important to kind of talk about like all this drama that there is with the tear trough. There's a few doctors online that are saying, I'm never injecting the tear trough again, I'm having so much problems with it, and patients are coming up saying they've had problems. So let's talk about the problems in the tear trough, because I've treated actually nearly, so I've treated nearly tens of thousands of tear troughs. I don't get thousands of people coming back. Mainly, and also I haven't just done that over the last 2 years, I've done it over more than a decade. So I can see my patients that come back after a decade as well. And we'll talk about some of the issues that you can get with a tear trough if you don't get it treated correctly or if you're not the right candidate. And then we'll also talk about, like you said, the second way of treating the tear trough, which is an emerging treatment that I think is really going to improve the safety. So what problems do you see with the tear trough in practice?
So with a tear trough, it's an area that people often present with because they feel they're looking aged, they feel they're looking tired, they feel that the area is sunken in and it gives them that aged, tired look. Often people see pigmentation there when in fact it's not pigmentation, it's just shadowing because of.
So it's this hollow that comes from the middle of the eye down to where the pupil is. That area is defined as a tear trough. And sometimes it's genetic, you can be born with it, you can be born with that hollow, but as we age, sometimes we lose the fat in that area. So it's really kind of simple. You replace that with dermal filler, with hyaluronic acid, and you get a more refreshed look. Back in even 3-4 years ago, we used to be using more softer gels within the area. So the hyaluronic acid filler used to be soft, light, and fluffy, as well as moldable. And the best place to inject it is deeper down on bone, so it doesn't draw in so much moisture. But we know as the time goes by, because this area moves a lot like this, it can move, the filler can move up to the surface of the skin, and then you can get this kind of swelling within that area, and that's what you sometimes see with patients.
So what I see with the tear trough is you have thinner skin there compared to the rest of the face, and you have, for a reason that we don't truly understand yet, but ultimately will be a genetic cause of selective loss of fat in the area. So you have thin skin and loss of the filling within or underneath the skin. So I see it as almost a pillowcase, that the casing of the pillow or the sac of the pillow has thinned out, and also the filling within the pillow, whether that be the down feather or any other filling within the pillow, has also reduced in volume. So the aim ultimately to correct that normal variant, which it's not an abnormality, it's a normal variant, that's a trough in there, the deep trough that you see and people complain about, is to fill it, and hyaluronic acid being one, fat transfers being another, using your own fat, micro fat transfers into the area.
Yeah, my wife, I did fat transfer on my wife, worked very well, and she's maintained with small amounts of dermal filler ever since. But look, hyaluronic acid attracts water, so people worry about being puffy years later. You know, has that got a lot to do with the product as well?
No, I mean, it can be if you use the wrong product, it can be if you use too much product, and it can be if you also put the product in the wrong area. And those are the three pitfalls where you almost certainly will get a problem, and the single most common presenting problem is puffiness in the area.
So if we talk about it, like what I found and what I always tell practitioners when I'm teaching them how to do the tear trough is not really go beyond this mid-pupillary line, because the muscle gets a lot weaker as we go up into this area of the eye, and you can allow natural migration of the product, and it means even after like 10 years you won't get problems. The reason why you don't want to inject so close in this area is that it can block the lymphatics, and you get what's called sort of like almost like a festoon within that area, as you can see on screen, and that can be difficult to remove, and sometimes you have to remove it under ultrasound when somebody's been overzealous in that area. Also, if people use the wrong filler, something that's too thick and attracts too much water, the delicate area underneath the eyes, then you can end up with issues as well. And also, if you use softer gels and not kind of newer gels, like for example Restylane Eyelight is a much firmer gel that is designed to inject less of the product, so you get more of an effect, and also it doesn't draw in as much moisture as other hyaluronic acid fillers do.
So the selection of the product is crucial, I think, probably the most important part of this. And also when you put the product.
Under-treating the issue. So the moment that you've got a fully flushed tear trough, you've probably over-treated that patient.
Yeah, bear in mind it should never be fully flushed. I mean,
and what is the tear trough for? It's to, when you cry, to move tears away from your mouth so you don't have salty tears in your mouth.
In fact, it is a trough. I mean, that's
exactly what it is.
Functioning as that. So, going back to the point about the lymphatic drainage as well, we have done a video on lymphatic massages around the eye.
Oh yeah, the gua shots.
Gua shots, and that's exactly what channel is blocked and exactly why you can get puffiness if you put too much in the wrong area.
And you know, some people watching this video will know that have problems with their tear trough. And one simple question I ask every single patient before I have tear trough is, do you wake up with puffy eyes? And if you wake up with puffy eyes, you can't have tear trough filler. If you've got a displaced fat pad in that area, i.e. eye bags, you can't have a tear trough. If when you cry, your eyes really swell up, you can't have tear trough. And there's so many patients that have been incorrectly treated, and that's the reason why we see such complications, because the people that are doing it are not selecting the right patient, they're not selecting the right product, and they're not putting it in the right place, and they're sometimes using far too much.
What can we do now? Well, we still do use hyaluronic acid filler, we still do use microfat transfers, but we can now also utilize something called polynucleotides in aesthetic treatment in the tear trough region. So tell us about polynucleotides.
So polynucleotides are things that actually stimulate your own collagen. So they actually create an environment where you produce more collagen. They can draw in a little bit more moisture temporarily, but essentially you're building collagen and elastin within that area. So a lot of patients say, when I smile, my skin's a lot more lax. I don't want the downtime with laser. Can you do something injectable? Polynucleotides are fantastic for that. It can be injected in all layers of the skin, in the fat, even up into the surface layers of the skin as well. And it's got a great history of use within medicine, healing of superficial ulcers, wounds, immediate wounds, burns. It really helps the recovery of these things. And if you think about it logically, in this tear trough area, there's a very small amount of gap between your skin and the bone, and just the thickness of the skin alone will improve it. So patients that their skin is so thin that they can't have hyaluronic acid fillers, then polynucleotides injections are fantastic for. Now, there's many different brands of polynucleotides out there, and we've been injecting polynucleotides for the last 2 or 3 years, focusing on the eye area as well as the face to stimulate the collagen. And it's something that really should be a part of everyone's practice. So say if you've got thin skin underneath the eyes, you do need a little bit of volume, you treat with polynucleotides first to thicken the skin, make that area have more collagen and elastin that you've lost in that area, and then maybe replace with filler if you need to. So in conclusion, tear trough is actually a very safe treatment as long as it's done by an advanced practitioner who knows how to actually inject filler within that specific area, and also takes a deep medical history to ensure suitability. But for patients that are in that gap where they just need a mild improvement, and if you worry about kind of swelling and lymphatic pressure and things like that, then polynucleotides are a great alternative. They do need a little bit more maintenance and a few more treatments, but it's definitely something that's what I call a new frontier in aesthetic medicine. Combining is where it's all at, because as we age, we lose volume, we lose collagen, we lose elastin. So losing volume, fillers, fat transfer. Losing collagen, elastin, more polynucleotides, and also things like Sculptra. But Sculptra is not currently approved for around the eye area, and that's where polynucleotides are really, really useful. That's perfect. If you have any other questions, but just let us know in the comments below and we'll get back to you. That's one of our really important things, interacting with you guys. Don't forget to click the link to subscribe, as well as that bell button, because that will tell you when new videos are going to be uploaded. We've got loads of videos coming for you guys. Thank you so much.